Hey there, and welcome to the Airplane Spoon podcast. Real stories and real questions about feeding children. I'm Serena Merle, feeding therapist and director of the Airplane Spoon. And today's question is a question that I think is relevant for all parents of all children, especially babies as they're learning how to eat solids, but it doesn't stop being equally important and relevant as children grow. And the question is, what is the difference between gagging and choking? This is such an important question because we're thinking about a natural learning oral reflex versus a safety and survival concern. Gagging and choking are often confused. Sometimes people will say, like, I'm choking on water, and it's misused. And today I want to explain to you what are the differences between these and what can we do? How to understand that this might be very different for children that have sensory differences, whether because they've had a medical trauma and more hospitalizations that have affected their sensory systems, or maybe they have a sensory processing difference or a neurodiverse um, identity like autism, and that might affect the way that their mouth reacts to different types of foods and textures. So let me jump right in. Gagging is a reflex. It's just like when the doctor hits the knee and then the leg kind of pops, it's a reflex. And the gag reflex is designed to be very protective when we are babies. So when a child is born, then the reflex to gag is at the very, very front of their mouth. And this is because the brain knows this baby does not know how to maneuver anything that goes in the mouth, so they don't want to choke on it. And so if they get something in their mouth, they're going to gag. And as babies grow and they're exploring more with their hands, with toys, and they're putting things in their mouth, they naturally start to push their gag trigger point further and further back. Now, we all have a gag trigger point. It might be in the back third or fourth of your tongue. It might be way in the back, maybe hitting the back wall of the throat or even down a little bit further. But the idea is that the gag doesn't go away, but it doesn't get in the way when we are eating anymore. The older and bigger that we get, the more that we are eating solid foods. So, what does a gag look like? A gag is in the mouth. The idea is that the food is still in the mouth. It's somewhere in the mouth. It could be at the front, middle, towards the back, but the brain kind of senses that that feels a little bit big and it should not go back any further. And so the body tries to push it forward or out. So a lot of times there's this really big squeezing of the abdomen, of the tummy muscles, like a pushing in this way to help push up the air. Um, and it could be very, very loud. For example, like the tongue is gonna push forward. Um, and sometimes you get redness or watery eyes, kind of like a little sweaty. And it might happen a couple of times to try to push it out, but this is the reflex. It's in the mouth. The child is trying to work through getting that more forward because it went too far back according to their mouth and where their comfort level is to trigger that gag response. And so we kind of like say loud and red, let them go ahead. We don't really have to intervene. It sounds scary. It sounds really concerning because it's loud, it's aggressive. It's almost like a pre-vomit. And so And sometimes children might vomit because they use the same muscles, and so if they had a lot of food to eat and they're squeezing that muscle where their tummy is, they might vomit. But working through that, it's okay. Their body is doing what it's supposed to do, and they're trying to figure out how to get that back to the front of the mouth or get it out. We don't need to hit on their back. We don't need to scoop in their mouth. They're just working through something that felt too big. But choking, on the other hand, looks very different. Choking is in the throat. It's not in the mouth. It's in the throat. Choking is an airway blockage. It is into the air tube. Instead of going to the back, the esophagus that goes down to our stomach where food is supposed to go, it gets pulled, usually because we're breathing in, and it gets sucked towards the air tubes, the trachea, where our vocal cords are here at the front of our neck, and it could be blocking. Now, what does choking look like? It looks like quiet. And instead of a gag where it kind of all squishes together and moves forward to try to push this thing out, choking is the opposite. It's open, very, very big open. And it's usually very quiet. It could be a little tiny sound like a that there's a little tiny bit of air going through, but it's mostly blocked. And it can be completely silent like this. And so the eyes will be very big and open. Usually there's less blood in the face, and so they might become a little pale or having some bluishness around the lips. Now, the phrase to help remember this is usually like quiet and blue, they need help from you. The concern around these little catchphrases of loud and red, let them go ahead, quiet and blue, they need help from you, is that that doesn't always work if you have a dark skin tone. You might not see those changes in the blood flow to the skin if you have a darker skin tone. But understanding that the sound part and the body gestures part is also related. So loudness, pushing forward, squishing up, maybe red, watery eyes, that's gagging. Let them work through it. It's okay. Versus big open eyes, they're usually looking towards somebody for help and they kind of stop. They're a little bit paralyzed in this. Um, and open mouth, and you're not going to hear it. Or if you're only going to hear it a little tiny bit, that's choking. That's when they need help. That's when they might need back blows to try to dislodge. And they might need CPR if they have so much loss of air that they lose consciousness or they stop getting oxygen. Now, it's important that anyone who is going to do CPR on a child has taken first aid CPR classes to understand, because we don't want to end up lodging it further in or harming the child. And typically, if you're calling 911, if you're calling an emergency line to get help, to have some medical people come to help, sometimes the operators can walk you through also what you can do to help in that moment until the professionals arrive. But having a clear idea of what to look for helps you to not feel so panicked that your child is not able to breathe if they're gagging. If you can hear it, if it's loud, they can breathe. They're just working through something in their mouth. It's not in their throat. Versus in their throat where it gets quiet, there's blockage and they need help. So the other piece I want to talk about was sometimes children have a gag response. Sometimes that food is not even in their mouth. And why does this happen? This is because their brain protective sensory response has become almost hypersensitive and overprotective. Now, if a child has tubes down their throat because of medical intervention, maybe they were born premature and they're in the NICU, maybe they've had different types of surgery or treatment and have had to have different breathing tubes or feeding tubes down their throat, that kind of creates a response in the brain that anything towards the mouth, going up towards the mouth, somebody touching my face is scary. It's a protective survival response because of their history. So we need to work towards trying to reprogram that so that they feel more safe and comfortable and they're not always getting into a gag response, especially for a child that has very, very sensitive gag response to vomit. If we trigger a gag and they vomit and maybe they lose all of their food that they were eating, whether that comes through a tube or if they had a meal, um, we don't want them to lose their food. And so we want to be sensitive in how we can try to slowly and gradually, and with the support of a feeding specialist, work to desensitize those gags. And also, children that have sensory processing differences, a lot of times neurodiverse individuals like autistic, um, have different types of ways their brain processes sensory information. So much that I've had children that just touching something like a Play Doh, even that's not even food, but it's kind of like a food texture, they gag. This is because there is a very strong hand to mouth correlation. So, however it feels in my hand, my brain is imagining how that will feel in my mouth. And if that child doesn't eat a variety of different textures, the brain says, nope, that's bad. That's scary. Get it out. So, the gag response, even though they don't even put it in their mouth, shows us that there's a very heightened sensory response that needs to also gradually be supported to be integrated so that that doesn't always trigger and turn on when we're trying to expose children to new foods. Okay, so that's what I have for you today on today's episode to think about what is the difference between a gag and choking? When are we supposed to do something and when can we kind of let it be worked through? Remember, gagging, loud, could have extra blood flow to the face, and they're working through a reflex in their mouth. The breathing is okay. Even if they gag and get it out, they can still keep eating. It's okay. You can work through it and have it not be such a scary moment that we have this big, oh no, oh no, oh no response, because then they're going to be even more scared about that versus choking. Choking is going to be more quiet, maybe completely silent or very, very little gaspy sound. That's blockage. That is a safety concern, and your child needs help from you. You need to call emergency services or do back blows to dislodge what might have gotten stuck and involve medical support in those moments. This is important because choking is a very high emergency room and safety concern for children. But not all of these episodes are choking, they could be gagging. And so, understanding what's going on in your child's mouth and what's going on in their brain for what kind of response they have can just give you more information for you to feel more empowered to better support your child in their feeding journey. Thank you so much for joining me for today's Airplane Spoon podcast. I hope you have an amazing day. Remember, you are doing an amazing job at supporting your child in their feeding journey. You've got this. Love, enjoy, and eat.